The world is changing. Inspiration is everywhere. It has never been so easy to connect, share, and bring people together. We're learning from others and finding the best in ourselves. Challenging our beliefs. Sharing our vulnerability. Overcoming our fears. Transforming ourselves so we can transform the world. How far can we go?
This is London Real. I am Brian Rose. My guest today is... This is London Real. I am Brian Rose. My guest today is Dr. Andrew Kaufman, the American medical doctor, professor of psychiatry, molecular biologist, and expert witness. You studied at Duke, MIT, and the Medical University of South Carolina, where you conducted and published original research and lectured to students, residents, and fellows. Throughout the COVID-19 pandemic, you have contradicted the mainstream media by stating that the coronavirus is not causing a new disease, that there is no evidence of increased mortality, and that modern medicine is the leading cause of death. Today, I'm looking forward to an uncensored conversation about the COVID-19 pandemic, the science behind the virus, and the global erosion of civil liberties. Dr. Kaufman, welcome to London Real.
Thank you so much, Brian. It's really quite a treat to be here.
I'm excited to have you. Before we get started, I just wanted to welcome you to the Digital Freedom Platform, and that's an independent technology solution that is of the people, by the people, for the people. It's available exclusively on our website. I just want to ask everyone watching now to please share this link via the sidebar and let people know what we're doing here. Doctor, I just want to say that I pledge to you that none of this will be edited and that anyone can watch the full version of this episode free without censorship or banning at londonreal.tv/Kaufman. Thanks to the generous donations of tens of thousands of people around the world, also known as the London Real Army. For anyone wanting to become a founding member of the Digital Freedom Platform, they can go to londonreal.tv/freedom to donate. Here at London Real, we've been a platform for free speech since 2011. And Doctor, I'm super excited to have you on today. And I think we maybe just jump right into it. And I wanted to know, what do you mean when you say that there is no evidence of the coronavirus causing disease?
Yeah, well, that's an excellent question. And what I've done is I've gone ahead and looked at all of the papers where there are scientists claiming to find evidence for a new virus, that they claim to isolate the virus. And I've basically scrutinized their procedures, and I've compared that to the history of how viruses and other diseases are proven to cause disease and how they're identified. So I've become familiar with the procedures and how they work. And what I've found is that the scientific procedures that have been utilized in all of these scientific studies are actually, it wouldn't be possible using those techniques to isolate a virus and purify it and prove that it exists. So what they've done really is they've done kind of two things. So one has to do with the genetic material, and one has to do with isolating a viral particle. So I'll talk about those separately. I'll talk first about the genetic material. So the general procedure that they utilize is that they identify someone with an illness that is unexplained, like this happened with the first group of patients in Wuhan, China, but it's been done in several other places around the world. And they have taken lung fluid from those patients, and they do this through an invasive procedure where they put a fiber optic scope through the mouth or nose down in through the windpipe into the lungs, and they squirt some fluid there and slosh it around, and then they suck it back up. And that would have basically a mixture of different things. It's a very impure sample, so it would contain, secretions from that area, like sputum. And it would also contain a mixture of different cells, such as our own lung cells and our immune cells. It would also contain various microorganisms that are present in our normal tissues, like bacteria and fungi. And then it also, lung fluid has shown to contain free genetic material as well. And then it would also contain what's called exosomes, which have their own genetic material. And I'll elaborate on what they are in just a minute. And so they took this sample of lung fluid, which has genetic material from many sources, and they added an enzyme that would digest any cell membrane. So it basically allows the DNA or RNA to be free in the solution so that they could do further analysis. And then they've identified a sequence of RNA that they allege is from a coronavirus or from the coronavirus family. But the thing is that since this sample is impure and has many sources of RNA, it's impossible to know what the origin of it is. If they wanted to be certain that it came from a virus, what they would do is take that lung fluid and filter it, because you can purify viral particles by filtration because they're much smaller than any other cells, even bacteria cells. And then you typically use a centrifuge with a density gradient that creates a tight band of these particles that's easy to suck up in a pipette. And then you could take those particles and extract the genetic material and say that it came from those particles. But when you have an impure sample with lots of sources of genetic material, you really don't know where it came from. So what their solution to this problem is to compare the identity of the sequence of this RNA with other known RNA sequences. And they specifically compared it with the SARS-CoV-1 virus, which was the virus allegedly responsible for the SARS outbreak in 2003.
You say allegedly. Well, I guess we'll get to that, I guess.
Yeah, well,
Okay.
The thing is that they used the same exact procedures when they did the experiments for that virus. So, in other words, they got the genetic material from an impure sample also, so it's not clear where the origin of that is. So you can follow this back in a chain to some of the original papers, and what I've found pursuing that is essentially the same exact procedures used each time. But how they said that this represented a coronavirus and was related to the SARS-CoV-1 virus, in fact, they call this virus the SARS-CoV-2, is that they looked at the identical nature of the sequences, and they found that it was just under 80% identical. And that's how they said, well, it must be related, and so we'll call it SARS-CoV-2. But the thing is, if you look at the genetic sequence between humans and chimpanzees, you'll find that there's 96% sequence homology or identicality. And so we are clearly not the same as chimpanzees, and no one would say that our genetic material is part of the chimpanzee family. But yet they're using a sequence identity that has a much lower percentage, under 80% compared to 96, and saying that's a coronavirus because of that. So in my opinion, this is extremely weak science, and without purifying the lung fluid sample, you really can't tell what the origin of the RNA is. So they've used this sequence to develop the main diagnostic test that they're using, which is the PCR test. And aside from any problems using the PCR methodology, we simply don't know what it's testing for because we don't know the source of that genetic material.
Okay, so they're going around testing people and they're getting back these results, and the results don't necessarily correlate to the person they're testing having anything that might be related to something that might cause a disease. You could get a quote unquote false positive for other things in the past, including maybe flu vaccines or colds or a variety of things that happened to your past, and now they're qualifying you as COVID-19 positive. Is that right?
Yeah, well, it's quite possible that this RNA actually comes from our own cells. So a positive test could just say that we've measured your own RNA. I mean, the thing is, we really don't know what it is, and it doesn't seem to correlate with presenting with actual clinical illness. So lots of people who don't have any symptoms and didn't get ill test positive for this, as well as many people who are ill and have symptoms test negative. So since we don't really know what we're testing, in my opinion, we can't trust the results of this test at all.
And so, but there are people getting sick and dying, and now we're being told that they've been tested positive for COVID-19. You know, when David Icke was here, and by the way, he was here about 3 or 4 weeks ago, mentioned you in your research, which is how you first got on our radar. And he talked about the exosomes, which we can cover shortly. You know, he was careful to tell me how the language in the media never says someone died of COVID-19. They died after testing positive to COVID-19. And, you know, doctor, now it's become a meme where even the public seems to be catching on, where, you know, somebody, some wife shot her husband in her home because they were locked down because of COVID-19, so he died of COVID-19. I mean, it's almost not funny that it's become a joke, because the public seems to know that now everything is being overclassified as COVID-19 related.
Yeah, absolutely. And, you know, this is a really important thing to look at, because this comes from directives from our public health organizations and agencies.
Including the CDC as well, right?
Yeah, the CDC issued a special document that's a guidance on filling out death certificates. And they've essentially gone away from their usual protocols where you want to have some certainty about the cause of death. And they've said that even if there's suspicion that COVID might be the cause of death, that you should just put that as the cause of death on the death certificate without any further scrutiny. In Minnesota, there was a directive that said if someone dies and you suspect it may be COVID-19 related, that not even to bother doing a test post-mortem, just label them on the death certificate as COVID-19. And then I also got a document, I think it was from the health commissioner or possibly the governor of New Jersey, a letter to healthcare providers. And it instructed them that in the usual procedure when there's a health crisis, that they normally would send bodies of people suspected to die related to the crisis for autopsy to the medical examiner. But it said in this case to not send any bodies to the medical examiner, to just essentially label them as COVID-19 deaths. And the only reason I could see that they would institute such a policy is that if they sent them for autopsy, they would probably find that they died of a regular cause. And this would affect the numbers in a bad way in terms of if you're trying to create the appearance that a lot of people are dying from COVID-19. So what I've done in order, since you can't trust this data about the cause of death because of these instructions.
And just, by the way, just want to interrupt really quickly. I've seen interview after interview with these doctors talking about how there's no precedent of any kind of guesswork on an autopsy and on a death certificate. You just say the evidence. And yet this is the first time they're being encouraged to write down the COVID-19. And you hear doctor after doctor talking about how peculiar this is. And I mean, I've gotten emails from people here in the UK telling me of scenarios where they took in their 80-something-year-old, grandfather with kidney failure. He was forced to sign a do not resuscitate order. He was told later he had COVID-19 symptoms. He died. Later, they were told he was never tested positive, but he was being qualified as a death of that type. I mean, we're hearing this over and over again. It's almost flabbergasting to hear.
Brian, I've even heard one account where someone's child, I think they were a young adult, died in a motor vehicle accident. And on the death certificate, it said they died of COVID-19, and they were really upset because they had no legal recourse related to the traffic accident to, file with the police or get reimbursed by the insurance company because the death was recorded as being from COVID-19.
I mean, that's ludicrous. I mean, somebody told me, I think it was Dr. Buttar told me a couple days ago that someone was driving a car with a face mask on, and he does not believe that those even should be used. Suffered from lack of oxygen, crashed their car, and it was COVID-19. It's just hard to believe that's even happening.
It really is. And there's so many accounts that I've heard directly from people speaking with me about this that, you combine that with the official documents and you see that this is going on. And so this is why I don't think you can accurately look at any mortality figures attributed to COVID-19 as being accurate whatsoever.
Why is this happening? Why would something like the Center for Disease Control, ask doctors to fudge numbers to inflate the COVID-19 related deaths? I mean, on such a mass scale and at such a high level.
Yeah, well, I'm certainly not advising the CDC how to proceed. So whatever I say would be somewhat speculative on my part. But in looking at what I do know about the CDC, one thing is that it is mostly funded actually by private industry. So there's something called the CDC Foundation, and you see that all of the major companies that represent the healthcare industry, such as pharmaceutical companies, health insurance companies, medical device companies, et cetera, are the financiers of the CDC. And they certainly have a lot of profit to gain based on having a serious pandemic and needing to sell vaccines or testing kits and things like that. I think the hospitals are in a different position financially right now. But it seems that all of the policies that they've initiated would have to be for the immediate purpose of inflating the perception of the health consequences of this COVID-19 situation. But it's definitely not grounded in reality. When I was in my 20s, I had a job for a couple of years. I was working for the New York City Department of Health, and it was in a CDC-sponsored position called a public health advisor. And my job was actually to go to hospitals and clinics around New York City and review charts to identify cases of AIDS. And I remember at that time, there were very specific criteria that had to be met in order to qualify a case of AIDS. And I would have to hunt down a lot of information in order to find out if the criteria was met. And if it was not met, I couldn't report it as an AIDS case. So the way that they are instructing people to report COVID-19 cases is a total departure from that approach. And it's very unscientific, and it's fraudulent in my opinion.
And look, I want to go a bit more into the science, but if you just had to take a step back right now, what do you think is actually going on? What's your gut feel here as to what is actually happening? You know, what's the most realistic scenario of what's happening?
I would love to answer that. And, you know, taking into account all of the evidence I've looked at, which has been almost entirely from peer-reviewed scientific papers and official government websites, my opinion is that this entire pandemic is a completely manufactured crisis. In other words, there's no evidence of anyone dying from any novel illness. And so what I think is going on, if you look at how the responses and government policies are changing, what we're seeing is essentially that we're having our rights taken away from us. So we don't have the right to leave our homes at our will. We don't have the right to assemble. We don't have the right to travel. We are asked to keep distance from each other. We're asked to cover our face, which is a major barrier to communication. And I see that people are becoming afraid of each other. We have policies in the financial sector where all of these businesses were instructed to close their operations. We have the supply chain for our food distribution systems being shut down, and farmers are asked to destroy meat and crops. We have the Federal Reserve is printing money like it's going out of style. They're buying up corporate debt. They're buying up real estate. All of these things fit to a situation that is in line with a sort of what might be known as a globalist agenda. And I think one document that you can look at that outlines this pretty well is from the United Nations, originally called Agenda 21, but it's been changed to Agenda 2030. And then you have now all of this talk about basically using technology to spy on people. And I'm talking about what they refer to as contact tracing, which sounds somewhat innocuous. The term was originally coined in 1931. And what this is basically trying to coerce us or perhaps even require us to put some kind of tracking app on our cell phones that will contain all kinds of personal data about our health, about where we go and what we do and who we associate with. And all of these things seem to be moving towards control of the people, like government control of the people, that they can track them, they can take away their rights, and they can grant privileges based on the degree that we might cooperate with what they want us to do.
Yeah, and not to mention controlling what we can say. So the freedom of speech and freedom of press They can say on these private platforms, which behave like public utilities, and again, we're working with some lawyers here to prove that a lot of these private social media networks and technology companies are in fact public utilities, especially during this crisis, because they're letting people know what they should and shouldn't do. Now we're seeing the freedom of speech being pulled back, and certain things cannot be talked about, whether it's COVID-19 denial, the 5G relation, all of that stuff. I've been a part of it. I've experienced the banning and deplatforming right on the back of that. And this is after 9 years of publishing long-form conversation with nothing happening. So yeah.
Well, Brian, I've heard about your story and all of you being booted off of all social media and other platforms. And I've actually taken some steps to back up all my material and have contingencies in case I experience the same thing after this interview.
Yeah, I mean, and we just had, Dr. Buttar on a couple days ago, and I know someone who was literally watching one of his videos on YouTube while it was pulled, and it just disappeared. And so, yeah, I started saving things as well. And, we've got this platform, and we've got another big stream coming up on Sunday with David Icke as well. And I'm asking people to literally screen record it, put it on a thumb drive, and bury it. Now, that might be an extreme, but 3 weeks ago when we were live streaming with David Icke, was the second largest YouTube live stream in the world, second only to President Trump. The last thing I would have thought is that would have been deleted, but it was. So yeah, we've got to watch what's going on. Was there ever a pandemic in Wuhan? This is my question, because we were all focused on what happened over there. Then we saw it travel to Italy and travel to Iran and travel to Seattle. Was that happening? Were there things happening on the ground? Or do you think that was fabricated?
Well, there were certainly a lot of things happening, but what they, and I don't know all the details about some of the other places. I've mostly been following things in the United States, but I know that they did actually erect a hospital facility in Wuhan very quickly. And I think it was really not even utilized. And I think it's been taken down since then. But when I heard about the final numbers, once things settled down over there, from a epidemiologist at the University of Manitoba in Canada, and basically he had calculated, based upon the reports of the data over there, what was the death rate, and it was essentially insignificant. So I don't really feel that there's any evidence of increased mortality. And this is the main statistic that I've been looking at, because the way that governments and other organizations identify a possible new health threat is that they look at what they call excess mortality. So in other words, compared to previous years, how many people are dying this year? And if there's a spike in the number of deaths, then that indicates possibly a new health crisis, and then that could be further investigated. So just this morning, I was looking at the CDC website, because they've been reporting weekly mortality statistics since the beginning of the year. And they have this table on their website that's updated on a daily basis, and I've been following it now for about a week. And it reports something very interesting. So it gives of course, the deaths that they attribute to COVID-19, but it also gives the all-cause mortality. So this is, the total number of people that died of any cause. And that is a much more reliable number. It still may have some inaccuracies, but it doesn't have all of the subterfuge associated with the COVID on the death certificate. And what they've done is they've compared this number to the average of the past 3 years, from 2017 through 19. During the same exact weeks. And then they have a running tally for year to date. And so what they are reporting pretty consistently is that the number of deaths this year to date, is less than the average of the past 3 years. And currently the number is 94%. So 6% less people have died so far this year in the United States compared to the past 3 years on average. And that amounts to 44,242 people. So those people would have died last year, but they're alive this year. So, if there's no increase in overall mortality, and in fact, there's actually a decrease, then what's the evidence that there's a new disease?
Now, could some of that be explained with the lockdown and people aren't driving and having car accidents? That's my first question. The second question is, you bring up a great point, and this is something David Icke mentioned 3 weeks ago, where was the increase in deaths? Since then, I've seen the mainstream media address this. I've seen New York Times show these little spikes in death rates going up in these different cities. So I've seen them show what looked like evidence of increased mortality. Just your thoughts on both of those things.
Yeah, well, the way that you display the information can really affect the perception. There's from day to day and week to week, there's variations in the number of deaths reported. So if you look on a small time scale and you see a spike here or a spike there, it could give the impression that overall there's an increase in mortality. But that's why I look at the year-to-date numbers, because that includes all of the deaths so far this year, which encompasses the entire period that we've been affected by this pandemic. And when you average those out, it sort of balances out the spikes, because there are also some weeks or days where there actually is a downward trend in the number of deaths. So you have to take all of those little perturbations into account and look at the total data set that's available, and that's where you'll really find the information.
Yeah, and both of us spent time at MIT in the late 80s, and I think if you, in any statistics class, you can be seen right away that data can be manipulated by how you present it on the graph or how you codify it. Everything that can be changed. What about this decreased mortality because of the lockdown? Is that an issue that can skew those results?
Well, it's kind of hard to say, because they're not keeping accurate records on the actual true cause of death. But you could certainly look at some possible areas where the death rate would be reduced. And certainly you mentioned one obvious one, which is decreased traffic accident fatalities. But all in all, being considered, that's actually not a big factor in the total mortality data. It's a relatively small number of deaths compared to the leading causes of death. The other thing that is really important to consider is that people are getting less medical treatment right now. And based on some studies from Johns Hopkins and one published in the Journal of the American Medical Association, medical care could actually be qualified as at least the third leading cause of death in the country. So if people are taking less medications or getting less medical care, then those number of deaths would be reduced. And there have been a couple of studies, one from Israel, and I think one is actually from England, where there was doctors went on strike. And during those strikes, there was actually also a reduced mortality. So one could, look at the numbers from those studies and do a comparative analysis, but it's really, there are some fudge errors to do that kind of analysis, since the current data is so incomplete.
All right, let me just stop you there really quick. So for people listening, you're saying medical care causes deaths in people. Can you go deeper on that? Because this is counterintuitive to everything we've been taught.
Yes, it is. So the study from the Journal of the American Medical Association I'm referring to talks about deaths attributable to prescription drugs, which are not used for an overdose, but taken as directed. So they're not taking extra by mistake or given the wrong dose by mistake. They're taking these medications as directed. And they estimate that annually in the United States, there's approximately 128,000 deaths attributable to prescription drugs. And just to give you one example of how that might be, if you look at Tylenol, a common drug, in Europe, you have paracetamol, which is related to that. Tylenol is acetaminophen. In the United States, pretty much every year, there are about 400 deaths that occur from taking Tylenol as directed. So what the researchers done is they've looked at a number of different drugs and made an estimate. And the reason they have to make an estimate, and they were very conservative in their estimation, is because there's no reporting or case capturing of deaths due to healthcare. So the CDC monitors deaths due to all causes except this one. So they really only look at illnesses and disease. They don't look at what's called iatrogenic causes, which is caused by the healthcare itself. The other study that is very prominent is from Johns Hopkins, and where they looked at what they called medical errors. And I won't get into their definition of that, but let's just trust their results. And they once again estimated 250,000 deaths a year from medical errors. Now, there are many other ways that the healthcare can result in fatalities, but these haven't been looked at as carefully, so I'll just not count them in my analysis. But if you combine these two numbers, 250,000 and 128,000, you get 378,000 deaths a year from healthcare. And that puts it above respiratory illnesses as the third leading cause of death, according to the CDC's numbers.
Wow. All right, that's a little grim, but we're going to have to just think about that for a little while. Let me ask you a personal question. What do your colleagues say about you being so outspoken? Because after talking to Dr. Buttar a couple days ago, it seems that this is a case of people keeping their heads down, because if they put their head up and go against the common, consensus of what's going on, whether it's WHO one day or something that the government says the next day, I mean, you can be vilified. Yeah, how are you being reacted to by colleagues?
Well, that's a great question, and I've definitely had some negative experiences as a result of this. But I want to say that for healthcare professionals, especially doctors, you've got a lot invested in your career. You've put a lot of time in. You've had a lot of delayed gratification because during all your training, you've lived at very low standard of living. And all this time, most of us have accumulated quite a lot of debt, sometimes, more than $250,000 of debt. And so when we finish all of that training and finally get to practice and start earning a reasonable income, we end up buying a bunch of things and then getting into more debt. And so our whole lives are sort of stuck in this cycle. And if we start to question what we're doing as doctors, and believe me, we all observe that treating patients with the typical, drugs, radiation, and surgery, which were the only things we're really allowed to use, we see many times people are not getting better, and many times they're actually getting worse with this treatment. But if we acknowledge that, then it puts us in a very difficult position that we have to take a risk to actually sacrifice all of that hard work and all of the income that we need to pay back our debts and keep our life going. So for an individual to take this chance, you might end up out of a job. You may end up losing your home. Your car may be repossessed. Your kids won't be able to go to private school. Maybe your spouse will decide to leave you. So there's huge risks. And even myself, I have been working over several years to try and mitigate this risks and get out of the system overall. And it's been a gradual, stepwise process. And I believe that I'm going to be very successful in doing that. But for everyone else, it's much more difficult. So many of my former colleagues and friends even who are psychiatrists or other kinds of doctors have not been very happy about what I'm saying at all. And, and some of them have completely written me off. But on the other hand, I have had a lot of new people reach out to me, new colleagues, and many doctors, actually, who really appreciate that I've been speaking, honestly about what I think and taking the risks that I have. And, they're very supportive, and they want to learn more, and they want to figure things out, and they're going to be facing some very difficult decisions about how they deal with their career moving forward.
I had a flashback to this Hollywood movie where Alec Baldwin's playing some surgeon, some cardiac surgeon, and he has this line where he says, when someone's loved one is in the hospital and they go to the chapel there and they pray that they're going to make it through, he's like, who do you think they're praying to? They're praying to me because I am God, And I think we have this feeling as the public that doctors are somehow these gods, these angelic, without fault people, that everything they say and do must be the right thing, when in fact they're human, they're fallible, and they're wrapped up in an entire establishment and industry that is based on writing papers that are for studies that are funded by pharmaceutical industries. And there's a lot of vested interests, even if it's not an intentional decision by them, there is a vested interest to kind of go along to get along, and do things they wouldn't normally be the logical things to do. Is that right?
Yeah, you're absolutely correct. And there are so many forces really conspiring against doctors through their training to really be equipped to, think for themselves. And, this was all established 100 years ago through the efforts of Rockefeller and the Flexner Report. But what happens during your medical education is that they inundate you with so much information, and they really want you to memorize and regurgitate this information. So I remember early on in medical school thinking this is so different from my undergrad because, we both went to MIT, and MIT, their goal is to create scientists. So they want you to be able to think. So when I took, biochemistry and cell biology and human physiology there, the exams were open book because you weren't going to find the answers there. Right? The answers required you to think and solve problems. But there's no need to memorize reference information because that's going to change over time anyway. So you can use the book as a sort of resource, just like you might use a dictionary if you come across a word that you don't know what it means to refresh your memory. In medical school, by contrast, when I studied molecular biology there, on the exam, questions wanted you to regurgitate the name of an enzyme. And that's just really superfluous to your understanding. It's completely unnecessary to memorize the enzyme name. What's important is to understand the mechanism of the chemical reaction and what are the factors involved so that you know how someone's physiology might change based on changing conditions. And that's not what was emphasized at all. And I think the purpose of flooding you with so much information to memorize is that you don't have time to really think about what you're learning and question it. So one example that's particularly relevant to this situation has to do with what's known as Koch's postulates. So when I studied molecular microbiology in medical school, they introduced this set of rules called Koch's postulates, named after Robert Koch, a famous microbiologist and physician from a century ago, who they actually have the CDC equivalent in Germany is named after him. It's called the Robert Koch Institute. And he came up with a set of 4 common sense rules of how you prove that a specific microorganism is responsible for causing a disease. And so they emphasized the importance of that, but then they didn't go on to present the experimental evidence for disease X, Y, or Z on how those postulates were demonstrated. They just sort of expected us to assume that they had been, and they went right into learning about the specific organisms and the specific diseases they were alleged to cause. So when you go through this type of an education system where you have to just regurgitate information without really thinking about it, then you continue that pattern. And when you start to practice, they've structured the reimbursement system basically to require you to see as many patients as possible in as short a time as possible, because each patient encounter is reimbursed at a pretty low rate. So since you have all these loans to pay back, and then you have the overhead of having your practice, the building, the x-ray machine, paying nurses and a receptionist, and all of those things, that you basically have to just keep all day long seeing patients. And sometimes they only spend 6 minutes with a patient. So that's really just not enough time to think about things very carefully. You have to just come up with a quick response, usually write a prescription, and then move on to the next patient.
Yeah, 6 minutes, write a prescription, and move on. And that's kind of what a lot of the medical industry has become. Doctor, let me snap you right back to reality, to New York City, which isn't far from where you are in Syracuse. We're seeing images of these, well, we did a week or so ago, lines around the street. We see these still photos of these ICUs where there's 4 doctors with the whole kit leaning over people. There was all that talk of ventilators. I mean, it looks like a pandemic. People are dying there. Like, what is actually happening there? Because anybody watching us now would say, okay, guys, but there's got to be something happening, or 4 billion people wouldn't be locked down on this planet.
Well, I wish there was evidence of something happening that would justify this lockdown situation. But, you could show photographs of any ICU at any time and you'd see very sick people and you'd see doctors and nurses wearing a lot of personal protective equipment, especially if they were doing a procedure. So, it's nothing terribly out of the ordinary. What is out of the ordinary is that hospitals around the world are empty. And they have very strict security to prevent people from going in and seeing what's going on. So there's a relative paucity of, images and video from inside these facilities because of that. So, for example, I spoke to someone yesterday in Australia, and he was telling me that his son had like a sports injury, and they were worried about a broken bone. So, and this was, in a major city in Australia. So not out in the country, at a podunk community hospital, but a major hospital in a major city. And he had to basically be really stern to even allow them to come in. Like they just wanted to send them home without any care. But once he was able to get inside, he walked through the hospital and there was not one person there, not one other patient did he see. He went all the way to the radiology department to get an x-ray, and there was not one other patient getting any x-ray or any other imaging study. They took the picture and then he walked out of the building. And I've never encountered this in my entire professional career. Generally speaking, hospitals are always at or over capacity. And many times when I've tried to admit patients, they've had to wait, or I'd have to call multiple hospitals and find who had a bed available and do the best I could to secure that bed. I've seen patients waiting in the emergency department for over a week because there are no beds for the hospital. And I've never encountered a situation of an empty hospital, and I've never been to a radiology department that had no studies going on. In fact, it's really important to their business model because the equipment like MRI machines and CT scanners are extremely expensive machines. And so they have to lay out millions of dollars to purchase that equipment. And in order to recoup their cost for doing that, they try to run these machines around the clock, really, because each study that they do for a patient generates reimbursement. So it's just extremely counterintuitive and impossible to explain how all of these hospitals would be empty and not using all of their equipment when there is the largest health disaster that we've seen in at least 100 years. And then compound that with all of the layoffs of healthcare personnel. So in the United States, they're laying off nurses, pharmacists, lab techs, and other healthcare practitioners. And I've known people in my personal life who are experiencing this. So why wouldn't they need every single qualified healthcare professional to be on the ground treating people if there were so many people who were sick and dying?
Yeah, and the same thing's happening in London. I mean, for the last 4 or 5 weeks, I would walk by the Royal Free Hospital here in London near Belsize Park, and there's nothing going on but the rent there. I mean, there's just nothing. It's like it's just a dead zone. And I thought maybe I just couldn't see or I wasn't looking right, but there's just nothing happening there. And they built this whole 4,000 person Nightingale Hospital at the Excel Center, which is normally a convention center here, to be prepared for all the coronavirus patients. And now I don't even think it's been used. So I think the public is starting to see a lot of that evidence, and it's strange and it's concerning. You mentioned technology, about how we're rolling back our civil rights. They're starting to track us. It's mind-boggling to me that my mobile phone company is already giving out my location information. It's mind-boggling to me that Google and Apple will consider doing it. Maybe they already are. Whereas a few months ago, they wouldn't unlock a phone for the police if there was a serial killer. Now they seem willing to give everybody else's information up. So that's kind of boggling. But what about 5G? I'm curious what your stance is on that. And just for the record, I couldn't even say this word in the same sentence or paragraph as coronavirus, or literally we would have been pulled right now off of a YouTube stream. The video would have been deleted and I would have been systematically banned on platforms. And I've done that. Facebook 2 days ago stopped me from advertising on that platform. So I was spending £50,000 a month with them on advertising. Now I can't spend a dime.
To continue watching the rest of the episode for free, visit our website londonreal.tv or click the link in the description below.